Welcome everyone to our pre-operative education class for a hip replacement. Today, we are going to review all the things you need to know before having your hip surgery. Arthritis is wear and tear of cartilage in the joint. It can affect one or multiple joints. There are many different types of arthritis, with osteoarthritis being one of the most common types. Arthritis can cause joint pain, stiffness, and swelling, which can lead to difficulty walking and completing daily activities. The goals of a joint replacement are to relieve pain, improve function, and improve your overall quality of life. It is important to note that surgery will have a short-term impact on your life before the long-term benefits become apparent. Recovery times vary from person to person, depending on the procedure and your individual general health. It is important to note that complete recovery from surgery, which is, for example, the pain and swelling to go away, can take 6 to 12 months. Today we will discuss how to prepare for surgery, the surgical procedure itself, expectations on the day of surgery, what to bring to the hospital, therapy that you will have in the hospital, therapy that you will have once discharged from the hospital, and exercises that you can start now. Being prepared is key. Those who are prepared have better hospital experiences, fewer complications, and smoother and faster recoveries. This is a picture of a total hip replacement with the hip prosthesis in place. When preparing yourself for surgery, you will want to follow your surgeon's recommendations, learn more about your surgery, maintain or attain a healthy weight, maintain or improve your fitness level, have any dental work done at least 6 weeks prior to allow for proper healing and reduce your risk of infection, talk to others who have had similar surgery, but please keep in mind that everyone's surgical experience is different. And quit smoking at least 2 weeks prior, as smoking can delay healing, which can delay your overall recovery. When preparing your home, you should change your furniture layout to allow for a walker, move any frequently used items to waist height. As part of your recovery, you will have to follow 3 hip rules. These rules will be outlined in the next slide. One of the rules you must follow is that your hip bend more than 90 degrees. This means that you would not be allowed to bend over to pick up low-lying items immediately after surgery. Therefore, having any items you use on a regular basis at waist height will be very helpful. Prepare meals and freeze them. Arrange for help and equipment. Have grab bars and railings for the staircase. Ensure that seats are 2 inches above knee height. Having a cushion on your seat will prevent you from breaking the no bending past 90-degree rule. Again, we will review this in more detail on the next slide. Arrange for rides and transportation. Have skid-proof mats in the bathroom. And remove any scatter rugs and clutter to decrease your risk of tripping. These are the 3 hip rules that you must follow after your surgery. Your surgeon will specify when you no longer need to follow these hip rules. These are generally in place for 12 weeks following surgery. Rule number 1, you are not allowed to bend your operative hip beyond a 90-degree angle. This means you are not allowed to pick up something off the floor, or alternatively, you are not allowed to bring your knees up towards your chest. Rule number 2, You are not allowed to cross your operative leg or ankle. Therefore, while you are sleeping, you will want to put a pillow between your legs in case you roll to your side in the middle of the night. The pillow will ensure that your legs do not cross. Rule number 3, you are not allowed to turn your operative leg inward. Some surgeons will also follow lateral hip precautions. This means that you are not allowed to move your leg out to the side for 6 weeks. You will be notified by your surgeon if this is the case. This slide shows you the type of equipment that you will need for your surgery. There is a link on the Lakeridge Health website with the list of vendors local to the Durham area where you can rent or buy this equipment from. The picture on the far left is a commode chair. You will need a commode chair or a raised toilet seat with arms in order to elevate your toilet seat to allow you to not cross 90 degrees when sitting on the toilet. The next grouping of pictures are items found in a hip kit. The hip kit contains a sock aid, a long-handled scrub brush, a reacher, and a long-handled shoehorn. These devices allow you to complete daily activities without breaking any of your hip rules. The next item, which is the third picture in, is a two-wheeled walker. There are many different types of walkers. We strongly recommend that you rent or purchase a two-wheeled walker. A standard walker is a walker without any wheels, but it does not allow for a smooth walking pattern as you have to lift the walker as you walk. A rollator walker is a walker with 4 wheels. These move fast, and some people find that they move too fast to use safely right after surgery. We therefore recommend a two-wheeled walker as it is easier to control and it allows for a smoother walking pattern. The last item, the item on the far right, is a single point cane. You will need a cane immediately after surgery to help you climb stairs. You will also be transitioning from your two-wheeled walker to a cane while walking once you are safe to do so. There are other types of equipment, such as a bath bench or grab bar, that you may also find beneficial after your surgery. Many local vendors will be able to describe these to you in further detail and help you determine if they would be suitable for you. When you come to the hospital, you will want to bring your reacher and cane. There will be walkers that you can use at the hospital during your stay. Please bring walking shoes or closed-back slippers, comfortable clothes, including socks, pajama pants, or track pants, any equipment you use to help dress yourself, your hip arthroplasty book, any medication you take in its original packaging and a list of what you use it for, personal care items. This would include a toothbrush or toothpaste. We ask that you do please leave your valuables at home. On the day of surgery, you should have nothing to eat or drink past midnight, except for the medication you've been told to take with a sip of water. Please arrive at the directed time. Please check in at the registration desk with your health card, and be sure to know which joint and which side is being replaced. Surgery itself is approximately 1 to 2 hours in length. The type of anesthetic that is used is dependent on many factors, such as your past medical history. This will be decided upon prior to your surgery by your surgeon and anesthetist. From the surgical room, you'll be transferred to the recovery room. You usually will stay in recovery for about 2 hours. Here, your vital signs will be monitored. You will have an IV keeping you hydrated and a large, bulky dressing over your surgical site. You may also have nasal prongs giving you oxygen, and in rare cases, a catheter in your bladder. At this point, you will want to remember to do your deep breathing and ankle pumping exercises. These will be described later in the video. From the recovery room, you'll be transferred to the surgical unit. Here, you will be given pain medications. Please let our staff know whether or not the pain medications are effective for you. Pain control is important in order to allow you to get moving. You will be started on a blood thinner if you are not on one prior. The duration of this will be decided upon by your surgeon. Your diet will start with clear fluids and progress to a high fiber diet, and your blood work will be monitored as needed. Day 0 is considered the day you have surgery. The day you have surgery, you want to complete deep breathing, ankle pumping, and buttock contraction exercises every hour that you are awake. We will have videos demonstrating these exercises towards the end of the presentation. The goal on the day you have surgery is to transfer to a commode or bedside chair with nursing assistance. You will be able to put full weight on your operative leg unless otherwise specified by your surgeon. All mobilization practices are surgeon dependent. Post-op day 1 is considered the day after you have surgery. You will be going home on day 1, the day after surgery, unless otherwise specified by your surgeon. In the hospital, you'll be walking to the bathroom or the hallway with your walker, completing exercises 3 times a day, and managing your own personal care. You will be seen by a rehab team, which consists of an occupational therapist, physiotherapist, and a rehab assistant. The occupational therapist will show you how to use your hip kit aids to get dressed without breaking any of your hip rules. They will also discuss transfers, such as getting in and out of a car or shower. The physiotherapist will help you get walking and teach you how to do stairs if you have stairs at home. The rehab assistant will go over exercises with you. We will be reviewing these exercises today towards the end of this presentation. In order to go home, you need to be able to get in and out of the bed by yourself or by helping your leg in and out of the bed, walk to the bathroom with a walker, be able to climb stairs if you have stairs at home, and be able to manage your own personal care. When it is time to leave the hospital, you will need to make arrangements for transportation home. You will likely have staples closing your incision. These staples are to be removed 10 to 14 days post-operatively. You will be told whether your surgeon or family doctor will remove them. You will receive medication prescriptions and a referral for outpatient physiotherapy. Once you are home from the hospital, you want to continue with your exercises 3 times a day. Continue walking with your walker and take any medications as prescribed. Ice your hip at least 3 times a day for 10 minutes. Please make sure to cover your incision with a cloth or towel to prevent the incision from getting wet. It is very important that you do not leave the ice on for longer than 10 to 15 minutes. Always inspect the incision site after icing. Elevate your leg 3 times a day for 45 minutes to help decrease swelling. And remember to ask family and friends for help as needed. A referral for outpatient physiotherapy will be given to you before you leave the hospital. You have the choice to attend any physiotherapy clinic that you want. Lakeridge Health has 5 hospital-funded outpatient physiotherapy sites, which are located in Bowmanville, Ajax Pickering, Oshawa, Port Perry, and Whitby. All of these clinics are located in the hospitals with the exception of Oshawa. Oshawa has an off-site outpatient clinic about 1 block west of the Simcoe and Rossland intersection. There are other OHIP-funded and privately owned physiotherapy clinics in the community where you can also attend. It is important that you know where you want to go for physiotherapy following your surgery before you have your operation done. When the rehab team comes to see you while you are in the hospital, they will ask you which clinic you would like to attend. If you choose to attend a Lakeridge Health clinic, a referral will be faxed to the site according to your home address. The original will be given back to you. You should expect to start physiotherapy approximately 2 weeks after returning home from hospital. If attending a Lakeridge Health clinic, the clerical staff will contact you within 10 business days or once an appointment is available. If you have not heard from them in this time frame, please call to ensure that they have received your referral. Until you see an outpatient physiotherapist, you are to continue the exercises in your hip arthroplasty book. Some other considerations. There is usually no driving for 4 to 6 weeks after your surgery. Usually no flying for 6 to 12 weeks after your surgery. Inform your dentist of your joint replacement before having any dental work done, as antibiotics may be recommended. Please also inform your surgeon about your upcoming dental work if it is very soon after your operation. If you have any questions about any of these above items, please discuss with your surgeon. You must keep your incision clean and dry to avoid infection. Your incision will likely be closed using staples. You will be told whether it will be your surgeon or family doctor removing your staples. You will go home with a bandage covering your incision. Different surgeons use different types of bandages. Ask your nurse before going home if you are supposed to change your bandage, and if so, when. Also ask if there are any other considerations. To avoid constipation, you should drink plenty of fluids, maintain a high fiber intake, be as active as you can, and discuss stool softeners or laxatives with your physician or pharmacist if constipation has been an issue for you in the past with surgery. Before you have surgery, you should practice the following things while keeping your hip rules in mind. Practice walking with your walker, getting in and out of a car, getting on and off a chair, getting in and out of bed, using a reacher, practice using a shoehorn, and putting on socks and pants. Please watch the video demonstrations provided for each of these. Okay, walking with the walker. Before starting to walk with the walker, you want to first ensure that the walker is at an adequate height. To check this, you're going to place your arms at your sides and you want the handle height of the walker at your wrist crease, or essentially where your wrist is bending. To walk with the walker, you're going to move the walker forward, step with your operated leg, followed by your non-operated leg. When you step with your non-operated leg, it may be helpful to push with some weight through the walker so that your operated leg doesn't have to carry your full weight. It's also important when walking to practice a heel-toe gait pattern. What this means is as you step forward to try and contact with your heel, and then come through and try and push up off of your toes. When walking with a walker, you want to make sure that when you step, all 4 points of your walker are on the floor. If you happen to have a walker with 2 wheels like this one here, you do not have to lift it to step, but instead you can just push it. When turning with a walker, you never want to pivot or twist on your leg. Instead, what you're going to do is bring the walker with you as you take small steps to turn. Getting in and out of a car. It tends to be easiest to get in a car on the passenger side, as well as to push the chair back as far as it will go to allow leg space, and to recline the seat slightly to ensure that you do not break your hip precaution of bending more than 90 degrees on your operated leg. What may also help you in getting in and out of a car is to place a garbage bag on the seat, and this will help you just to pivot or slide in with less friction than the car seat. To place that in, you'll just drop it right on the car seat. To get in, you will back up until you feel the car behind your non-operated leg. From here, you will reach back to hold the car and the seat and kick your operated leg forward and front to ensure you do not bend greater than 90 degrees. Once seated, ensure your bottom is fully on the seat and then pivot as a unit into the car. If you are unable to lift your operated leg in or out of the car, you can also assist this with your hand. You would bring your non-operated leg out and assist your operated leg with your arm. And again, coming up to a seated position, ensure you're not greater than 90 degrees. Getting on and off a chair. Before you sit in a chair, you do want to ensure that the seat height is adequate to maintain your hip precaution, that you're not bending more than 90 degrees at your hip. So you want to ensure that you never sit in a chair that is below the height of your knees, otherwise add a cushion to bring up the seat height to maintain that precaution. It tends to be easier to get on and off a chair that has armrests and a firmer seat. When you go to sit down, you are going to back up with your walker until you can feel the chair behind your non-operated leg. From here, you will straighten your operated leg out in front of you as you reach for the armrests of the chair and slowly lower yourself down. In a seated position, you want to ensure that you are never crossing your legs, and again, making sure that your knee is never above the height of your hip. To stand up, you will reverse this process. You'll push from the armrests of the chair, never pull or push on your walker as it can move or tip. Again, make sure that you do not lean forward because of your hip precautions, so you will push straight up from the armrests of the chair and then hold on to your walker. Getting in and out of a bed. It's important when getting in and out of bed to make sure that you maintain all of your hip precautions. It tends to be safer to put a small pillow between your legs to ensure that they'll stay in a neutral position as you get in and out of the bed. What you will do here is slowly lower down onto your side as you lift your legs up to the bed, and then you can roll onto your back. When coming up from the bed, you will do the same but in reverse. So you can roll onto your side, slowly lower the legs off the edge of the bed, and push up with your upper body to a seated position. If you are not able to lift your legs in and out of the bed, you can also use a strap to assist your lower body. You would place a strap around the foot of your operated leg, and then again, lower down onto your side. Your hands can assist in bringing your leg up, as well as getting out. Your hands can assist with the strap in lowering the leg, and then pushing up with your upper body. Using a reacher. A reacher is part of the hip replacement kit. It is a tool used to assist you in picking up items on the floor, as you cannot bend forward, as this would break your 90-degree hip precaution rule. So to reach for something that's below knee height, what you would do is squeeze the trigger of your reacher to bring it up to a safe position to grab. Okay. A shoehorn is also part of the hip replacement kit. The shoehorn will be helpful to assist you in putting on a shoe, since you are not able to reach down to the floor because of your hip precaution of no bending past 90 degrees. To use a shoehorn, you'll place it in the back of your shoe, slide your heel along the shoehorn to lower it down into the shoe. From here, if you go to take your foot out of the shoe, you can also assist in using the shoe horn to remove the foot. Using a sock aid. A sock aid is also in your hip replacement kit, and it will assist you in placing a sock on since you are unable to lean forward to touch your feet to do it. To use the sock aid, you will place your sock over the front of the aid, pulling up your sock to make sure it gets all the way on, and pull it to about the groove of the sock aid. You will then use the straps to lower it to the floor, place your foot into the sock aid, and pull up using the straps until your sock is on. Putting on pants. Because of your hip precaution, you are not able to reach down to your foot to place your pant leg on your operated leg. Instead, you will use a reacher to assist this. Place the seam of your pant leg into your reacher and lower them to the floor. It is easiest to place your operated leg in the pant leg first and use the reacher to assist in pulling up your pant. Once you have your pant leg on, you can lift your non-operated leg to put your other leg in. From here, you will push from the bed or the seat you are on to stand up. You can hold onto your walker for support and then lift your pants the rest of the way up. When taking pants off, you are going to lower them past your bottom. Reach back for the seat or the bed. Have a seat. It is easiest to take your non-operated leg out first. And then you can use the reacher to assist you in lowering your pant leg down your operated leg. Please watch the following videos to familiarize yourself with these exercises. All of these can be started now. These exercises can also be found at the back of your surgical book, which can also be found online at the Lakeridge Health website. Immediate postoperative exercises. After your surgery, you will begin 3 exercises. These we recommend you complete 10 times every hour that you are awake. The first is deep breathing. Here, you'll take a big breath in through your nose and out through your mouth. One good way to remember this is to smell the flowers and blow out the candles. The other 2 exercises you will complete in lying. Lying on your back, you will do an ankle pump. This is moving your foot up and down as well as in circles. The third exercise you'll complete is a buttock contraction. Here, you will think of squeezing your buttocks, hold for 5 seconds, and slowly relax. Straight leg push on back. In a lying position with a rolled towel under the ankle of your operated leg, push your knee down into the bed to contract your thigh muscle and straighten your knee. Hold for 5 seconds and then relax. Again, push the knee down into the bed, hold for 5 seconds and relax. Repeat 10 to 20 times. Hip and knee bend. In a lying position, place a strap around your foot. This could be the strap off a robe or an old sheet. From here, you will use your hands to assist you in bending your hip and your knee upwards, sliding your heel along the bed. Please ensure you do not go past 90 degrees due to your hip precaution. You will slowly lower the leg back down. So slide up and slide back down. Repeat 10 times. Quad strengthening over a roll. In a lying position, place a rolled towel under the knee of your operated leg. Using your thigh muscles or your quads, push your knee down into the towel and lift your heel up from the bed. Hold for 5 seconds and slowly lower back down. Push the knee down into the towel and lift to raise your heel off the bed. If you are not able to lift your heel up immediately after surgery, you can assist this in using a strap placed around your foot and do as little assistance as you can from your hands to help you complete the motion. Repeat this 10 times. Hip flexor stretch. Lying on your back with your non-operated leg bent and your operated leg straight out in front of you, lay like this for 10 minutes or as long as you can tolerate. This is an important exercise to stretch the front of your operated hip. Hip abduction. Some surgeons do follow lateral hip precautions. If this is the case, please do not complete this exercise. If you are unsure if your surgeon has lateral hip precautions, please contact your surgeon or physiotherapist before completing this exercise. Here, you will slide your operated leg along the bed out to the side and slowly bring back to midline. Ensure that you never cross your leg. Slide out and bring in. If you are unable to slide your leg out to the side, this may be easier by placing a garbage bag under the heel of your operated foot. Repeat this 10 times.